Products are sort of the first point of contact that most people have with design. You have your phone, you have your car, and in the healthcare context, you have, you've got an IV machine, right? You've got a hospital bed. So products are something that are very central to design in the most mainstream sense. But then we get into things like, how do you create an emergency wait room in a way that's most conducive to having people come in, get the service that they need most quickly, not just for the person who's come in for care, but also the people who work there. Design's kind of gone beyond that to also consider environments and systems. So the healthcare system itself is very complicated, and when we think about something as challenging as home care, where you have folks who, where we have all of this, there's a lot of information that they have our services overrun. How do we design a system where people are still able to get a good level of care, given the constraints that we have around cost, and what kinds of policies do we need for that? What kinds of arrangements between public and private do we need for that?
It's about thinking about the future in specific ways, alternative futures. We started last year with 240 students in level 1 thinking about the future of health. And the reason that was important is because for the most part they don't think about the future except in very specific ways. Their path is already mapped, they know what they're going to be doing next year and the year after. And many of them run into the disappointment. So Foresight's a useful tool to get them to think more broadly about what the future could look like, where they could fit in, what options they may have, but an opportunity to reinforce that over a period of years. The larger issue with Foresight, in contrast to design, is that Foresight is also something you can do alone. So Foresight starts with collecting information from your environment, from the past and from the present, from the literature, from conversations, anything that in their terms constitutes a signal. So it's an opportunity to collect thousands of pieces of information. So many of the issues in health are about culture change. They're the same sorts of issues that exist in university. They're about culture change, and changing culture is really hard.
A lot of folks feel pretty powerless in the system, right? It's so big, it's so overwhelming. What are they going to do to have any sphere of influence over, even just their sort of little bubble of work that it's been, sort of so regulated and so streamlined? And where is there any opportunity to have investment in creating that environment? I think that's what it comes down to in terms of the culture, right? That people feel like they are, co-creating something. That what happens to that patient, that they feel like, that they have some responsibility for.